Live, a virtual town hall, COVID-19 and health equity in Virginia. You ask, we answer. Sponsored by the Virginia Department of Emergency Management and the Virginia Department of Health.
Thank you for joining us tonight for this virtual town hall, COVID-19 and health equity in Virginia. You ask, we answer. I'm Juan Condi. Tonight, Next Star stations across Virginia are connecting you with experts from the governor's COVID-19 task force to get you the information that you need and want during this pandemic. We have distinguished guests here tonight to address your concerns. First, joining me here in the studio is Dr. Janice Underwood, Virginia's Chief Diversity, Equity, and Inclusion Officer. She's also the head of the Health Equity Task Force. Thank you for being here with us tonight.
Thank you so much for having me. Really happy to be here.
It is a great pleasure. We've been seeing you in the briefings, and now we have you here on the set with us. Other members of the task force are joining in by Zoom this evening. Let's make sure everybody is connected. Please say your name and wave, or I'll say your name, wave at the folks so people know who you are. First up, Sabo K. Nelson, the Director of the Office of Health Equity. Wave your hand. There we go, an attorney specializing in public health. Also with us tonight, Dr. Ebony Hilton, critical care physician and anesthesiologist at UVA Health. Hi! We're also pleased to have Harrisonburg Mayor Deanna Reed joining us this evening so we can have the perspective of an elected official there in the center up top. And finally, Dr. Cecilia Barbosa, chair of the Health Equity Work Group Health Committee and a former chair of the Virginia Latino Advisory Board. Thanks for being with us. Thank you for sharing your expertise during these difficult times. Okay, so for the next hour, our panelists in a very informal discussion are going to be answering questions, I should say, that you've sent in from across Virginia. And if you still think there's something you'd like to add, we invite you to submit your questions during the special. We'll try to get to them and answer them live for you. So write down what you're thinking and send it to us on Facebook or Twitter. We're asking you to use the hashtag VAHEWG, which stands for Virginia Health Equity Work Group, in case you've been wondering. Team members are standing by to get those questions to us here on air. Better to do this sooner than later because our time will become short soon, but we'll keep this hashtag up on the screen for the next hour. Let's begin our discussion tonight with a look at the latest numbers in Virginia. The state health department's reporting 34,137 confirmed and probable cases of COVID-19 so far in Virginia. 4,093 people have been hospitalized. The death toll in Virginia tonight is one shy of 1,100 people. Governor Ralph Northam's the first to have a cabinet-level diversity office in his administration. Dr. Underwood, you are the chief officer and lead the Health Equity Task Force. What's the primary mission of the task force in the pandemic?
Well, like Governor Northam was ahead of his time, he appointed me to be the Virginia's first chief diversity officer. It's really the first position of its kind in the nation, and part of my responsibility is to lead the Health Equity Task Force. Again, another very inaugural mechanism for the nation. We were the very first Health Equity Task Force in the nation that was instituted in a proactive way. We have a whole government approach where we are literally doing things and making decisions, and part of the decision-making process, both vertically and horizontally. And it is really an opportunity to ensure unapologetically that health equity is a part of every decision.
So health equity has been a traditional problem in the Commonwealth, or an issue in the Commonwealth. Describe the conditions into which we entered the pandemic as far as that goes.
So we entered the pandemic financially really in a good place, but we also understand that there has been a structural racism, structural inequity for the last 400 years built into our society, built into our state. And what we see from that structural inequity are underlying health conditions, inequitable access to stable housing, for example, inequitable access to education and transportation. And so what we see now that we are in this crisis are those inequities bubbling up and showing themselves as elevated risk factors. So if you have those inequities, you're more at risk to come in contact with COVID-19 or die from COVID-19.
What specifically is the task force doing to help to rectify those inequities in the short time that we have with the constraints you have budget-wise, perhaps?
What's so incredible is that simultaneously to responding and in the recovery, the Northam administration is really thinking about how do we interrupt systems of inequity simultaneous to the response. Okay. So I'm really excited to share that the first time we passed legislation in 2020 that gives undocumented immigrants driver's licenses and driving privileges. That alone is going to be life-changing for so many. And those are the kinds of systemic changes that we are hoping to make.
Explain that for our viewers who may have a more difficult time understanding that in a political sort of frame. For you, this is not a political issue, it's an issue of equity and safety. Explain that. I want to be sure that we're explicit about that.
Sure. It's really a humanity issue. There are so many immigrants, undocumented, for example, who don't have a driver's license. If they weren't able to have a driver's license, they weren't able to perhaps drive their children to school or to get to doctor's appointments or even to get to a grocery store to get fresh food. And if they were caught driving, they perhaps would then be deported for breaking the law. And now that they have an opportunity to safely drive and understand that they have access to do all the things that we enjoy and take for granted, they now have that driving privilege and therefore have access to get to a doctor, get to fresh food, and get to education.
So it's sort of more a question of dealing with the issues and people that we have and the situation we have, not what we'd like to have right now. We're dealing with things on the ground. Thank you very much, Dr. Underwood. Let's move now to a question about the data surrounding racial disparities in COVID-19 cases. And for that, we'll bring in Sable K. Nelson, the Director of the Office of Health Equity. Sable K., thanks for being with us. What does the data tell us about all this?
The data tells us that there's a disproportionate impact on communities of color, and that we know.
Go ahead, please. There is a bit of a delay, Sable K. So when I say something, it'll come to you in a second, and then we can wait. You can go ahead, please. I interrupted your answer.
Not a problem. So what the data tells us is that there is a disproportionate impact on certain communities. And we know that Black and Brown communities in particular are being adversely impacted. Latinx, Hispanic, and Latino communities are more than sharing a higher amount of the COVID-19 burden as compared to white Virginians, and as also African Americans and Black Virginians are also carrying an ordinary and a disproportionate burden. And what we know about this, and what we know about what COVID-19 is doing, is it's exacerbating some underlying health inequities that were pre-existing, but are just emerging and just complicating the ways that we are able to respond to the virus, and also making certain communities more susceptible, which is a part of the reason why the Health Equity Working Group was created, to make sure that we can address some of those systemic issues, apply and make sure that there are resources allocated to the vulnerable communities, because equity means that you have a tailored approach. So that's giving communities what they need, when and how they need it, and not just applying a one-size-fits-all, because as we know, Virginia is very diverse, and it's going to take a diverse and equitable response for us to reach the end of COVID-19 in a better place as a stronger Virginia.
Sable K., let me ask you this. How do you think the perception is, if underserved and invisible communities are disproportionately affected by the pandemic, does Virginia not really have an idea of how bad the pandemic is affecting us because it's affecting people in those communities?
I wouldn't necessarily say that. The Virginia Department of Health Office of Epidemiology has been working very hard to make sure that they're able to collect as much of that demographic data as possible. So we actually started with a much higher unknown rate in terms of the demographic pieces, and now we've been able to whittle that down a lot. And because we're able to utilize and have a better understanding of who is testing positive for the virus, we're also able to make sure that we can tailor resources to that. And on top of that, the Health Equity Working Group is working collaboratively with our sister agencies across the Commonwealth of Virginia, also working in collaboration with faith leaders and community leaders and grassroots organizers to make sure that we use a collective impact approach, and we making sure that we leverage each other's strengths and also follow not only the data that we're getting from BDH, but also some other data that we're able to leverage that can show us where people are most susceptible based on who's living with certain comorbidities, what neighborhoods. We can get down to the zip code level. So it's not a matter of not having the information or It's better about being best able to utilize the information that we have and allocate resources and time and effort accordingly.
All righty, thank you very much. Let's also take a look now at the impact of COVID-19 in our Latinx community. And for that, Dr. Cecilia Barbosa is in. She is the chair of the Health Equity Work Group Health Committee. Dr. Barbosa, can you explain for me or compare and contrast? Well, first let's define Latinx, and then if you would compare and contrast the effect of the COVID-19 pandemic on that population as opposed to African American populations or Asian populations. All right, we're trying to get Dr. Barbosa up here on the Zoom. Give us a moment. It's a live show.
Good evening. Happy to be here. So the Latinx, Latino, and Hispanic is generally people who can claim their origins in Latin America, whether Spanish speaking or Portuguese speaking, and are a very diverse group. In fact, I mean, some have come directly from Latin American countries and only speak Spanish or Portuguese or other indigenous languages. Others are second generation or even a third generation. So, and whose only may not even speak the original languages of their ancestors. So a very, very diverse group. And also in terms of not only language, but culture, country of origin, profession, and education. But I think most vulnerable really are the people who are new to this country and are working in the service industries as frontline workers and essential workers, and who may both economically, that provides a professional risk, let's say, but also a language, potentially a language risk, and a cultural differences. So those are the things very different from the African American community. Mm-hmm. I'll let others perhaps describe that better, but you know, our histories are very different. Our histories in this country. So that although there are some similarities as well. Mm-hmm. But in terms of the vulnerability and let's say being outside of the system, you know, and having difficulties with access in general.
A study from the Economic Policy Institute shows that only 1 in 6 Latinos in Virginia have jobs where they can work from home, many of them on the front lines of the pandemic, either in customer service or in healthcare or in sanitation or custodial sort of work. I want to ask you, what's the most we can do, or how can we continue to keep them safe and support them through the pandemic?
So certainly access to resources, and I know that, for example, the administration has already requested some of the CARES funding, and I don't know if that's new funding from the federal government to be for some of the immigrant communities that don't have access to those, haven't had access to this date to resources. And there are certain things, for example, that has been done for promoting equity by helping renters keep their homes. People can lose their homes in this crisis, especially Latino families. So the governor is working to help tenants defer rent payments if they need to. He has proposed to change Virginia law to give tenants an additional deferral period if they cannot make their rent payments, which the General Assembly accepted. So that's one thing. Under the amendment, if a writ of eviction is filed against a tenant, the tenant can bring evidence to the eviction proceedings to show that they were impacted by COVID-19. So the other thing is food. Food is something that's of concern, and families can text comida or food to 877-877. That's 877 twice, to find food distribution sites nearby. Families and seniors can also call 211 to talk with an operator who can share nutrition and food assistance information based on their address.
Let's
So
talk
those
about
are some of the things. There's some educational resources today also that have just started. The Virginia Department of Education just launched Educación y Radio, the Commonwealth's first bilingual radio learning program. It's the result of a partnership with Richmond Spanish language station in Richmond. It's Radio Poder, and features pre-recorded lessons in various subjects for students, Spanish-speaking students in grades K through 12.
Dr. Do Virginia localities do a good job of providing the information to Spanish-speaking populations so far?
I think there are a lot of local organizations. There's the government certainly, and then there's a lot of local organizations that are also putting out information quickly. Some of the media organizations, some of the nonprofit organizations. So there's a lot of effort from many, many different angles, from the state government to local agencies and organizations that are really trying their best. You know that things change so quickly, so that's a real challenge to get the information out, because daily things are changing. It's
difficult to transmit that information effectively as quickly as it changes in English. Let's turn now to Latinos or Latinx populations who may be undocumented, ineligible for unemployment insurance. Are there programs available to them for financial assistance during the pandemic? If not, is that something that you guys are working on?
I don't know if there's anybody else. Are you asking me in terms of
please.
Unemployment insurance?
Are there options besides? Dr. Underwood can take the question if you'd like.
Yeah, I think so.
You prefer that? Okay. Dr. Underwood,
Yes.
the question's to you then. For undocumented or people who might not be eligible for unemployment, what sort of recourse do they have?
So thank you for the question. Under the guidance of Dr. Megan Healy, who serves as our chief workforce advisor, what we've done is we've tried to open up employment resources and unemployment insurance to those who have traditionally not been eligible. So in addition to undocumented workers, although those that there still is a challenge there, what we do know is we have opened it up as widely as we can. That being said, I'm really excited to share with you that the Health Equity Work Group is really thinking about and unapologetically thinking about how do we use and equitably distribute the CARES Act money so that undocumented and documented immigrants or new Americans can have access to those monies. They may not know where to go, they may not have the information or understand necessarily the processes to apply for some of these things. And so in addition to trying to support income, we're trying to figure out how can we get to undocumented communities who weren't eligible for example, the $1,200 and $500 payments from the federal government. We're really thinking about that and how to do that in a sober way.
Do you know, and I'm just asking you off the top of your head, what are the numbers of Latinx populations here in Virginia? How many Latinx do we count in Virginia among our 8 million population?
So right now, off the top of my head, I would say that they're probably about between 10 and 12%.
Okay, so quite a significant number. All right, interesting. We opened up our digital mailbags before You Ask, We Answer tonight and discovered many of you have straight questions about healthcare and how to protect yourself from COVID-19, the coronavirus illness. Dr. Ebony Hilton's joining us now, critical care physician and anesthesiologist at UVA Health. Dr. Hilton, looking forward to talking to you here on the Zoom. Yes, how concerned should the average person be about contacting or having a transmission of coronavirus and then displaying symptoms, getting sick with COVID-19?
All right. Well, what we know is that coronavirus does not discriminate, right? We are talking about health equity, but every citizen will be kind of susceptible to having this virus. And what we're estimating is that 1 in every 3 Americans will contract coronavirus before this pandemic is over. Now, what does that mean? Well, 80% of those typically have mild to barely any symptoms at all. And we call those, the asymptomatic carriers. And those are really the people that we particularly get concerned about in that they can spread this virus easily because they don't know they're infected. But what we know is that there's an additional 20% of people that will carry some pretty heavy symptoms, and whether that's complaints of headaches, loss of taste, loss of sense of smell. There's some people that have just pure GI upset. And then we have the typical presentation that people think of with coronavirus, which is going to be the chest pain, the shortness of breath, and the hospitalization requirements.
We just learned this evening in the news that transmission of the coronavirus may be more difficult through surfaces than we first thought. I'm not sure if you want to weigh in on that, but I want to ask you specifically about the bodily fluids or droplets that can transmit coronavirus. What are they specifically, and what should we be looking out for?
All right. So what we know is that it's a respiratory virus, meaning that we do pass it through our secretions, but it's really those large droplets that we get really concerned about, which is why you hear us all the time saying, particularly, that the use of masks are effective. Reason being is that if you are infected and you cough, those large droplets that come out of your mouth have the potential to carry a large viral load that can infect people that surround you. And so what we've seen based on looking at studies from the Princess cruise ship that was out at sea and doing other studies in the lab is that these coronavirus, the virus can actually live on stainless steel or plastic for upwards of 72 hours. So that's 3 days. And so what we tell people is really get in the habit of also when you're getting packages delivered to your home to make sure you wipe down those packages before bringing them into your home, or at least before you put them into their final destination. And after handling those items, be sure to wash your hands as frequently as possible.
Are there reasons to be concerned, doctor, about saliva, sweat, semen, other bodily secretions? Are there heavy viral loads in those fluids as well?
All right, we know you can at least get infected through other mucosal membranes, correct? The problem is that with a lot of these questions, our simple answer is going to be, we don't know. And what people have to realize, we're trying to give as much information as we possibly have, but this is a brand new novel virus. And what does that mean? It means literally our bodies have not seen this strain of coronavirus. And the way I explain it is that coronavirus is almost like a last name. You have many, my last name is Hilton. There's lots of Hiltons, right? But the very strain of my DNA is unique. And so with the coronavirus or the COVID-19, this strain of virus is very unique and our bodies has not seen it. And so we don't know how the body will react. We don't know as far as even immunity, whether or not there's going to be long lasting immunity or immunity that lasts only a year like the common coronavirus, or is it upwards of 3 years like the COVID SARS-1, right? So we don't know which version this virus is going to kind of behave like.
It's really just fascinating, this whole pursuit here. We've seen a push in Virginia to increase testing and bring testing to more people. Let's listen to a viewer question now. Brian Furr from Hampton Roads asks about that testing and if people are feeling COVID-19 symptoms. Let's listen in.
So I've heard there's different types of COVID testing. What kind should I take?
All right, Dr. Hilton. Brian wants to know, how do people know what kind of test they need and which tests are available and accurate and effective?
Right, so you'll see a variety of tests being talked about on the news, right? We have our molecular tests, our nucleic acid test that tests for the actual mRNA or the genetic code of the coronavirus or COVID-19. We'll see, we'll talk about antigen tests, and that's when the virus actually makes a protein that we can detect. And then you'll hear about antibody tests and which one of these should we be doing. So it depends on which stage of infection we're actually dealing with. If you have an active infection, if we're trying to see if you have the potential to infect someone else, then what we want to do is a nucleic acid test. This is the diagnostic test that were first talked about. And what we'll see is that as you progress in your disease process, once your symptoms are completely gone, we can then test you for an antibody test, right? That says, gives us an idea of whether or not you have any form of immunity. Now, the thing with these tests you will see in news reports is that there is a likelihood of what we call a false negative. And what does that mean? That means that although you are infected, the test can in fact come back reading that you are not. And the reasons for this it varies. One of the reasons is that you literally depends on how much virus you are actually expelling at that time. And very early on in your infection, you're not producing expecting a lot of virus that is going to be able to be sampled from your nose, correct? And so when we do the test, it comes back negative. And so if you're going late in the progression of your disease, if you've been symptomatic for 5 or 6 days and now we're on day 8 or 9 and you're starting to get better, if you go get tested, your viral load may also be low at that time, which means that although you are indeed infected and are positive, that test will still read negative. And so you'll hear your doctor say all the time, we rely on that test as an adjunct to what we're seeing with you. Regardless if it comes back positive or negative, if you are symptomatic, if you are looking as if you are infected, we will tell you to treat yourself as if you were.
All right,
and we'll tell you to do those preventative measures for your family.
All right. I want to mention, Dr. Hilton, that we have a vast amount of information right here on our Facebook page in real time about the things that we're talking about as we go on. And I want to mention that everything you've said, Dr. Hilton, is independent of the fact that the virus is a 14-day incubation period?
Completely. And even with that, it's a variation. We know the range that is typically 14 days. But what we see is that there are some people who are testing positive for much longer. Now, what does that mean? Does that mean that person is still infected? Does that mean that there's virus that's just being shed and that person is not necessarily contagious for other people? We're unsure. But what we do know is we say on average, the incubation time is about 2 weeks. Okay. So we ask everyone a couple different things. For one, if you are just exposed to someone that we know is positive, we say that you too should be in quarantine for 14 days. We've all heard that kind of acknowledgement, right? But if let's say you're asymptomatic, but you tested positive, what we tell those persons is that from the time of your test, we want you to at least wait 10 more days before you go out in public. And some people say, well, why is it 14 for someone who didn't even have a test? And that I did have a test. Well, because we give that extra little wiggle room for the person who was exposed to someone but not tested, because we're going to try to give you 4 days before you start to present with symptoms. Well, we know it's on average, it takes about 5 days after a person gets exposed before they actually start to show signs and symptoms, and whether that's coughing, whether that's fever, whether that's GI upset, whether that's headache or loss of taste and smell. It typically takes about 5 days before you even see it.
And for a vast number of people, 80%, they'll have mild symptoms or none at all. Let's move on now to this terrifying multi-system inflammatory syndrome that's been discovered in kids with COVID-19. The Department of Health reports one case in Fairfax tonight. One viewer asks, what is multi-system inflammatory syndrome and who is at risk? Dr. Hilton, how can you comment on that?
Right. So unfortunately, it is one of these things where we know viruses can cause a number of different disease processes, particularly for the kids, and one of which is called Kawasaki disease, right? And this multi-inflammatory syndrome is kind of similar in that it's just an overwhelming fight or flight system that gets activated within our children. And unfortunately, it kind of goes along the vascular system. And so what we see with these kids is they can have actually some changes to the arteries of their heart. They can have changes to the arteries of their GI system, the vasculature of their GI system. And so at this current time, there's actually 100 cases being reported in the United States in over 14 different states. So early on in the process of talking about COVID-19, there was a lot of talks of, oh, our children are protected. You know, they have lesser of the disease process. But the truth of the matter is we are still currently very much learning every day something new about this coronavirus. And so we need to take it seriously as we begin to open up our economy.
All right, Dr. Hilton, going to give you some rapid fire questions now. Easy, quick answers so we can keep on going. It's 7:28, got 32 minutes left. As we approach summer, people are worrying about vacations and hanging out. Should we cancel travel plans? Will it be safe to swim in pools? Will it be safe to swim in the ocean?
The truth of the matter is, at this point, for me and my family, we are staying put. Reason being, you need to have 3 things in place before we can truly be safe. Those, I call them the 3 T's. That's going to be testing, tracing, treatment.
I'm sorry, repeat those.
Point,
testing, what, and treatment?
We're not up to par on the testing. We are still hiring, and VDH is doing a fantastic job at hiring for these tracers, right?
Okay.
But we need to start tracing and looking at community spread, particularly since all the other states are opening up too. And then the third is going to be treatment, of which we're still getting in the process of our medications, our vaccinations, and the ultimate treatment, which is going to be the ability for those who are actually infected to be able to isolate. And we need to give them resources that they can actually stay at home.
Okay, Dr. Hilton, would you feel safe, or would you feel that your family is safe going out to eat in open air, shopping in a store, or getting a haircut or your hair styled?
Again, for me, the answer is no.
Okay.
What we know, particularly for African Americans, 1 in every 2,000 African Americans that was alive in January has died from COVID-19. 1 in every 3,000 Hispanic Americans that was alive in January is now dead. And that's the truth of the matter of what we have to face. We've lost now over 95,000 Americans that we know of. There are some that are not going to be accounted for because they didn't get a test. And so at this point, until we get a handle and a better grasp on how to manage and treat this virus, going to that restaurant is simply not worth the risk of me not seeing my niece and nephew again.
All right, since the government's been recommending that people wear masks in public, doctor, there's been a lot of confusion about what you should do with your kids. What are the rules for kids wearing masks, and are there exceptions for those who are very, very young or have conditions like asthma?
Right, and it's particularly very challenging. I have a 40-year-old niece who you can put a hairball on her 1 second and it's off the next, right? So I understand that it's going to be very difficult for parents. And that's why I say choose the locations that you have to go with your child wisely. We know our children are very curious and they like to put their hands on things. And like we said earlier, coronavirus can live on those surfaces for upwards of 3 days. So we don't know who has just walked by 5 minutes prior to that. And I saw a story about a parent who unfortunately had to bury their child at the age of 5 that said, you know, when you say something is rare, that's one thing, but when it's your child, it's the absolute world. And with things like this, we may not get a second chance. So I always say with everything that you do, just consider, is it worth it?
And let me finish with this with you, at least for now. And that is with our final question. And that is, again, I want to be clear. Do we yet know if people who've been infected by the novel coronavirus can be infected again? I jumped a little bit ahead of the question we have here in the monitor. But if you've been infected, do we know whether or not you can be infected again with any kind of certainty?
Right. So at this point, to say 100% certain that you couldn't, I would be lying. Honestly, we don't know. What we do know is that there are certain people who are testing positive for longer periods of time than we would assume they should. And this has been happening not only in China, but also here in the United States. Now, the problem is that with the tests that we're using to test if you're positive or negative, it looks at the fragment of the virus's DNA, their genetic code. And so the question is, are these just fragments of the virus that we're picking up? Or are these people actually able to infect someone else? At this current time, we're leaning towards the fact that these are just fragments and inactivated portions of the virus, that you are not infected. But to conclusively say that, it's just too early for us to do. So whether or not you can get infected twice, whether or not there's lasting immunity, we're only weeks into this pandemic. And unfortunately, it typically takes upwards of a year before we would truly know.
Dr. Ebony Hilton from UVA Medical Center, fantastic information. Thank you for your time and for reminding us all that no matter what, caution is probably the best course of action for the time being. All right, because our health crisis is forcing businesses to close or reduce services, employment and unemployment have become big issues in our pandemic. A woman we spoke to in Richmond today has several questions about that. Let's listen in.
When are medical assistants going to be able to go to work? You know, those of us who have graduated college, we can't get jobs. Why are all the bigger corporations open and all the smaller stores are still closed?
Okay, for this question, let's bring back Sable K. Nelson, Director of the Office of Health Equity. Sable K., talk about that first question and the job outlook for people who are graduating and looking for work.
Yes, so I know that this is a very, very challenging time, and I know that there are concerns about businesses being able to sustain themselves, but it's also one of the reasons why the Health Equity Working Group worked intentionally, and we encourage you all to reach out to the Virginia Small Business Administration. There are a lot of different resources and a lot of information available on that website, and the idea is to make sure that we are connecting the small businesses with the resources that they need, knowing that a lot of them haven't been able to access them for a variety of different reasons. And our goal is to make sure that we try to protect not only the lives of individuals, but also the livelihoods, and for people who have been working, and also for those newly emerging into the workforce and into the market.
What would you say to folks who question how larger retailers have been able to, say, sell flowers while smaller locally owned florists were deemed non-essential? Can you weigh in on that?
I wouldn't say that, I don't want to pit like larger businesses against smaller businesses necessarily. I can say that it has been more difficult for some of those smaller businesses to navigate. This has been a very, this experience has been very fraught with lots of different steps that people have to take, which is why we try to make sure that we, the Health Equity Working Group, try to make ourselves a bridge and work collectively and collaboratively with smaller businesses to make sure that they can also be here and still provide their services after COVID-19 passes. So it's not to say that there's a bigger business or versus a smaller business thing, but what can we do to support those smaller businesses who are having a little bit more difficult time, who may not have the infrastructure, who may have some other demands in terms of taking care of family, and like who may not have access to resources and loans and things of that nature to sustain themselves in a way that a larger business entity would, but still doing what we can to support them at this time.
That's a fair answer. Sable K, one of the most common questions we're getting from folks who have applied for unemployment is that they haven't received benefits or they haven't heard back from the VEC. Quickly, what should those folks do? What recourse do they have?
I would encourage them to reach out to our Small Business Administration and to reach out to the governmental agencies. And I would also ask Dr. Underwood, I know this is one of her colleagues in the work that they're doing, and she may have something to weigh in. All
right, Doctor, do you want to weigh in, Dr. Underwood, on that?
We just know that this is a challenging time for all of us, and I just have to say that our unemployment system has been stretched to the limit.
Yes.
And the number of cases and requests have been so many. Our unemployment numbers before the pandemic were at a record low, and now we see while we are lower than the national average, we still know there's so many people struggling. So what I say to everyone is, if you haven't been able to get through, please keep trying, because we want to help.
And VEC has improved its staffing. According to Governor Northam a few weeks ago, they really are dealing with a crush of folks. What should employees who are afraid of going back to work for fear of COVID-19 do when they think their workplace is unsafe?
That's a great question, and fair as well. We know a lot of folks are really reticent to go back to work because of those fears of whether or not they're going to be protected, whether or not they'll have PPE or the sanitation processes that are necessary for those of us to feel safe going back to work. And there is a hotline that they can call into. You can also call 211. If you can't remember a long number, call 211 and they can direct you to how you can make a complaint.
All right, wonderful. And we know that hundreds of complaints are being formally investigated tonight here in the Commonwealth after complaints from citizens about conditions at their workplace. Very difficult situation because you may be afraid of going to work, but you're not allowed to collect unemployment if your reason is fearing COVID-19. So it's a bit of a bind. Again, we're all in sort of new waters here. Let's talk now about reopening and what that means on the ground here in Virginia and how public services are meeting or missing the needs of our citizens. For this, let's turn now to Harrisonburg Mayor Deanna Reed, who's been absolutely patient, waiting with us for the last 38 minutes. How is the city handling the reopening process so far out where you guys are, Mayor?
Okay, I need you to repeat that because they were talking to me.
Sure. We want to thank you first for being here and waiting so long to get in the conversation. How has your city been handling reopening, and what do you think you guys are doing right? What do you think you could improve there in Harrisonburg?
Right. So, we just recently went into the phase one of reopening our city, and it was a difficult decision for us to make. But because we have been aggressively bringing testing to our city and working with Dr. Underwood and the Health Equity Work Group in order to get supplies here in Harrisonburg, we felt like that we could go ahead and move forward. Our businesses, they are following procedures, and we have met with them to make sure they are following what needs to be the recommendations by Governor Northam and the requirements to open. So right now, I believe we're doing well. Of course, as mayor and member of city and my colleagues on city council, we are watching the process.
Are your numbers still going up, Mayor, or are they decreasing? Is your rate of cases decreasing? And what's the state of the numbers there in your town?
Well, our numbers are rising, but our numbers are rising because we're testing. And we know that it's going to take us to be testing more and more in the city in order for us to save lives. So just this past weekend, we collaborated with our county, which is Rockingham County, and we were able to do, we were able to test 315 people here between the city and the county. And we're now looking at doing more testing after the Memorial weekend. So we've done a lot of testing here in Harrisonburg. And that's why our numbers are high.
Like Accomack County on the Eastern Shore, you have poultry plants in your district there. Can you explain for us what outreach you've been able to offer the workers there and tell us how they feel about their conditions right now?
Right. So I appreciate you asking that question because the health and wellness of our residents who work in our poultry plants is something that we, as a city council, have made much conversations about. We have worked closely with those facilities, both in Harrisonburg and in our surrounding county, which is Rockingham County, to understand exactly what they are doing to protect our residents and to make clear the expectations of the city. In fact, we as a council reiterated those concerns and our desires to work together in a letter sent to the Virginia Poultry Foundation by City Council just this past April. And we do understand that the plants are making efforts. I myself have been on a conference call with one of the plants in Rockingham County, and they're making efforts to protect the employees. But we as a city have taken additional steps to try and reach employees of these facilities who live in Harrisonburg. And a huge part of that effort has been a collaboration with Dr. Underwood and the Health Equity Work Group. Through the Health Equity Health Equity Pilot Program, we were able to distribute over 5,000 masks and 600 bottles of hand sanitizers, which has made an incredible life-saving impact on more than 1,100 families in our community. So without that donation, which we received less than 24 hours, we would not have been able to reach as many of our vulnerable our families in our vulnerable neighborhoods. So we are watching our poultry plants. My vice mayor, Sal Romero, has been a driving force behind that. He is making videos in Spanish to do outreach. We're trying to get as much information into our Hispanic communities. And we're also, like I said, bringing testing to our vulnerable neighborhoods.
Mayor, hold on for one moment. Dr. Underwood wanted to dovetail or get on the back of what you said there. Dr. Underwood?
So what Mayor Reed is talking about are our pilot programs.
Yes.
And we have partnered with the City of Richmond, the City of Harrisonburg, and the City of Chesapeake. And for each locality, we have given and allocated 20,000 masks and 20,000 bottles of hand sanitizers. And we help them using our mapping technology to really pinpoint which neighborhoods are at elevated risk. We can literally go down to the neighborhood or zip code level and say, who are those families that have 4 or more in the home, so they don't have the privilege of social distancing, so they need life-saving PPE, or who have an income of $30,000 or less, or who are dealing with comorbidities such as heart disease or diabetes that make them more susceptible to COVID-19. And so those localities put together a coalition of volunteers, and each locality is also equipped with health equity training modules that the Health Equity Task Force created, and they train their entire local city government on how to do things just like the Health Equity Task Force is in the Virginia Unified Command. How can they embed health equity in their local unified commands? And then it's up to the locality to distribute. So Mayor Reed just shared that they were able to reach 1,100 residents. Now they are going to go back and go back and go back until they know that all of their residents have all 20,000 of those masks and all 20,000 of those bottles of hand sanitizer.
A simple physical barrier can make such a big difference in this pandemic. Let's go back now to Mayor Reed. Mayor, one of the most important functions of local government is educating our children, and kids have been out of school for months now. What is your outlook there for returning to school? Are you looking at changes in schedule, policies, procedures? How are y'all going to handle that?
Right. So, you know, everybody thinks my full-time job is mayor, but my full-time job is actually, I'm a program director for an after-school program that actually runs in the school system. And my vice mayor actually is, he works in our central office for Harrisonburg City Public Schools. Yeah, we're all concerned about what our school year is going to look like, when are our kids going to get back to school. And I think our children are ready to get back to school, but we have to make sure that they're safe. And as you know, the Virginia Department of Education has already created a task force to look into all the questions and concerns where we go from here as a state and local communities when it comes to education and COVID-19. So we know this coalition of teachers, education leaders, and stakeholders will make the best possible decision for our students and our family. I can say that here in Harrisonburg, the Harrisonburg City Council will continue to work closely with Harrisonburg City Public Schools and our school board to assist them in any way the city can as they move forward. And I will hope that this will be the case for all cities and counties. But really, nobody really knows quite yet when our students are going to go back to school, when our universities are coming back. As you know, we have JMU University, James Madison University here, and Eastern Mennonite University here. And so we're waiting to see, but we know that we have the right people in place to make those decisions.
A lot of data-driven decisions to be made in the future. Let's talk about public access, public accommodation. Folks who've written into us say they want to know when their favorite activities and events are going to return to normal, their festivals, their concerts. Let's listen to a question now from Diana Capilli, who's from Hampton Roads.
How will we know when it's safe to go to large events again?
Other folks who reached out to us were more specific about the events they hoped to attend. Let's listen in here.
I attend Union Branch Baptist Church, and we've not had service since the third week in March. And we've been abiding by all the rules. But as I travel, I see all these churches still having service.
I'm a wedding photographer, and I'm just wondering when people will be allowed to celebrate events again, and like what the rules and regulations will be. I've had 12 weddings for this year rescheduled, so I'd love to know when I can photograph weddings again.
Mayor, again, I'm not going to put you on the spot, but these questions are going to be decided by the data. What do you think the future looks like for large events or weddings or church services? Many pastors have decided to delay those for some time.
Yeah, I mean, that's tough. I mean, we're going to have to see, you know, what Governor Northam recommends, and he's watching the data, and that's really all we can do. I know here in Harrisonburg, our churches had the opportunity to open at 50% of capacity, but from what I know, only one did. And so we're really just kind of taking it day by day. There's no large gatherings here, and I don't foresee that happening anytime soon. Even with our restaurants, they are eating only, they're still doing carry out, but if you have outside seating at 50% of capacity, you can dine that way. But we still had some restaurants that didn't even take advantage of that. So we're going to be just watching the numbers and following the direction of Governor Northam.
Well, we wish you good luck. Thank you for your service. Harrisonburg Mayor Deanna Reed, a pleasure to have you with us this evening on You Ask, We Answer. All right, let's move now to a live question that we've just received during our show. We want Dr. Hilton to answer this one. It is there any threat of testing actually giving people coronavirus, and how can school systems keep kids safe on crowded school buses? Did you hear that, Dr. Hilton? We're getting her back up now.
So perfect. So I heard the question as far as whether or not the test can actually give you coronavirus.
Yes.
So there's a number of different conspiracy theories that are going around. There's a 5G conspiracy theory. There's another conspiracy theory that coronavirus doesn't exist at all, right? And this other conspiracy theory that if you get tested, that's how you actually get coronavirus. And that's simply not true. What we know is that these tests, the reason why there was such a delay in testing getting up to speed was because each individual swab has to come in a sterilized pack, meaning that when you open it, if there's any risk of contamination, the entire test is void. And so what you'll see is that there's a number of different confusing things out there that we need to really watch if we're spreading that information, because that false information is giving people this fear of either getting tested or doing things to keep themselves safe. And what we know, again, like I said, we have children that have died from COVID-19. We have young people between the ages of 20 and 44. That's 30% of the people that we have in the hospital. This is not just an old people disease that we keep hearing on TV. It's not just people who have pre-existing disease that's also dying from this. We have young, healthy, 30-year-old people that have passed away within our hospital, right? And so when we're saying these things, particularly because I've been watching the thread on Facebook, but when we're saying these things, I think one of the commenters was that if you take the test, you get the virus, but also that commenter said that he and his wife took the test 3 times. And if you don't have the virus at this point, then that means that test was not giving it to you, right? So one of the things that we know is that the virus is very easily transmitted, that we do want people, if you are symptomatic at all, to go and call your physician so that you can get tested, because we want to try to contain this virus as much as possible to keep not only Virginians safe, but our entire nation safe.
Let's turn to the second part of that question, which asked about school bus safety. Packing kids onto a crowded bus every morning and every afternoon seems like it would be an insurmountable sort of task if you're thinking about sanitation and keeping droplets from one kid and another. How can we best handle that? Or what's a best case scenario for handling that?
Right, and I honestly feel for parents. My little sister is actually a principal of an elementary school, and she called me yesterday saying, what do I need to do? She's a principal at Mean Street Academy in Spartanburg, South Carolina. And the thing is that it's very easy to tell adults to stay 6 feet apart and to wear a mask. And it's very challenging to tell a 3-year-old to sit still for 3 seconds, right? So how do we navigate that? And I think Governor Cuomo said it best and when he was talking about New York City and saying that the way we used to do it has to change temporarily. And that's what I really want to drive home, this idea that life may look very chaotic right now. We're hoping it won't be chaotic like this for years and years to come, but we got to get to those years and years to come, which means we have to do what we have to do now to be safe so we can all stay alive. And so what that may mean is that when it comes down to opening up schools this fall, we may not be able to in the same way. We may have to go to some virtual education, and whether that means teaming up with local cable channels to say, for these basic TV channels that are free for the public, can we live stream our classrooms onto those free stations so as many kids as possible, regardless if they have Wi-Fi, internet or not, are able to still get their education? Then that may be one of the avenues that we have to do. But this pandemic will cause us to be innovative and push us to another level.
But the issue of kids on crowded school buses is one for which we should have concerns and one for which we're going to have to plan.
For sure, it should be definitely something that we consider. What we know, like I said, is most kids will not show symptoms, and which is great. Most kids will have no problems with coronavirus, which is great. But there are a subset that will get this multi-inflammatory syndrome. And if it is your child, at that point, the entire world seems different. So I just want us to consider that. Every N of one, every study of one in someone's world.
That is a fair point. Thank you very much, Dr. Hilton. Back now on the desk with Dr. Janice Underwood. I think about that all the time. If you're not connected to someone who has coronavirus, or if no one in your family has coronavirus, then it seems very distant to you. And that's something we have to always be careful of. Perhaps because of a lack of direction at the federal level, states have been putting together a hodgepodge of systems, a variety of systems to count the number of people they've tested, to count the cases and their antibody testing and their antigen testing and molecular testing. Everybody's keeping their own set of books, it seems. Has, in your opinion, Virginia lagged in testing? Where do we stand in relation to the rest of the nation tonight?
Well, you said it just yourself, that we have had a very fragmented and disjointed federal response, and so we've all been competing for the same resources and really competing against each other. And the testing in Virginia, we have been at the lower levels, and we admit that, but we've been doing everything we can to raise those numbers. And what I'm so proud about is that Governor Northam set a goal, and I haven't seen any of our national leaders set a goal. He set a goal of 10,000 tests a day, and we are getting closer and closer to that goal every single day. And when we hit that goal, it might be time to change the goal and increase it even more. Because as Dr. Hilton said, we have to have testing. We have to have testing. Let me repeat that. We have to have testing in all neighborhoods, especially our vulnerable communities, particularly our hardest hit communities like the Hispanic and Latinx and African American communities. Because what we know for sure is that Hispanic and Latino communities are having a higher testing rate, but African American communities are having a higher death rate.
All right. All this incredibly important information. What testing threshold does Virginia need to meet for the Department of Health to feel like we know the true spread of coronavirus in the state? So is it, and I'm not asking you for a number, but just more like, how will you know when there's enough testing? What will be proven to us by the tests?
As was mentioned, this is a novel coronavirus, and we don't know what we don't know, but this is what we do know. We need testing, contact tracing, and treatment, and that was mentioned by Dr. Hilton. And the health equity team is really collaborating and linking arms with the contact tracing work group to make sure that we have contact tracers on the ground, contract supervisors on the ground that represent the communities to which they will be serving, so that we can understand where the virus is and isn't, where is safe, and who needs to self-quarantine.
Still hundreds of those positions open. If you're looking for work during the pandemic, contact tracing is still open. You may have to qualify. You can check out the state website for that. Let's go to a viewer question in our last few minutes here from Marquise Dudley. He's concerned that Governor Northam delayed phase 1 of reopening by a week, then delayed one further in Richmond, Accomack, and Nova. Let's listen in.
If you're pushing that back, does that mean everything else gets pushed back? Or are you still basing it off the numbers that you're getting as far as like how many people are getting coronavirus?
All right, let's clear that up. He's asking, after the governor delayed phase 1 from May 8th to the 15th, what does that mean for Virginia reopening further? Will it take longer than we think perhaps to get into phase 2?
So it really depends, and Governor Northam should be commended in the fact that he listened to people. And there were some localities that were mentioned, such as Richmond, Accomack County, and our Northern Virginia localities that said, we're not ready to open. We heard from faith leaders, we heard from community members, and we heard from frontline workers. They said that based upon the numbers, because we are tracking data and not dates, and that should really be underscored, that it is okay that one locality not go into phase 1 and one stay in phase 0. But that also means, and there are some localities that are asking us to already go to phase 2. So we need to, and as we learn more about the coronavirus and how it is dealing or really spreading or not spreading, how we can contain it and how we can live and move forward, again, Virginia forward, we really need to make sure that we follow data and not dates.
All right, important information again. Well, let's go to another question from one of our live viewers. They ask, is there a plan for hurricane evacuations this year while dealing with social distancing?
Yes.
Is
And
that real? Okay.
you should know that the Health Equity Task Force is thinking about that.
Okay.
We have been planning for that worst case scenario. Then how do you deal with this worst global pandemic in addition to a hurricane, especially those who live in the coastal regions? I'm from Hampton Roads, and we deal with hurricanes all the time. And so what we know is that in a regular emergency, for example, a hurricane, that communities of color and those who are economically disadvantaged are very disproportionately impacted. You put a global pandemic and a hurricane together, and that's a pandemic inside a pandemic. So we're thinking now and making preparations now to figure out how to serve the most vulnerable.
Interesting. In Michigan, where there's been severe flooding, they suspended some of their coronavirus restrictions, their social distancing restrictions for first responders who had to go rescue people, perhaps without knowing their status. All right, we've had a number of people ask us as well about housing and evictions and the governor's new Stay Home Virginia initiative. Here's a question we received from someone in Northern Virginia.
I know that you just implemented a resource, Stay Home Virginia. How do you feel that this will benefit or impact residents throughout the state of Virginia?
All right, what do we think that program will do for folks here in the Commonwealth?
I think that it's going to offer housing stability. We know that we're safer at home, but if you don't have a home to go to, how can you be safe? And that is something that the governor, the only doctor in the nation, governor, really understands. Housing insecurity is one of those social determinants of health that we have to keep front and center in all of our decision making. And so he did just on Monday announce protections where we could provide protections for those who are dealing with evictions, because we know as the courts open up, those are beginning to come on the docket, and we need to make sure that we protect Virginians.
Yeah, they are legal proceedings. They'll certainly be moving through our system. All right. Before we wrap up, we want to go back around to each of our panelists for one final thought that perhaps we haven't covered yet. Dr. Cecilia Barbosa, do you have anything that you'd like to close with this evening for us? All right.
It's actually a topic related, but we haven't talked about tonight, and that is the census. It is the year of the census, and we need a complete count. And it's related to COVID too, because the more we count everybody, the more resources we can get. But it's resources about everything we are, that's such as Medicare, Medicaid, child health programs, hospitals, clinics. This funding is for our first responders for the next 10 years. So it's really, really important for us to complete the census. It's online, over the phone, or by mail. So I wanted to share that message for everybody. There's actually a new deadline for the census. It's October 31st of 2020. But don't delay. Don't wait until then.
Don't delay. When you get that mailer, send it in. Thank you very much for being with us, Dr. Cecilia Barbosa. All right, let's move now to Sable K. Nelson. Final thoughts from you, Sable K., in our discussion tonight about coronavirus?
So much for the opportunity. I'm so glad that we were able to answer as many questions as we could this evening. The final thought that I wanted to leave with everyone is to check out and make sure that you periodically check the VDH website. We have the capability, if you go to vdh.virginia.gov/coronavirus, you're able to see the information that we have there. A lot of the questions, there are a lot of answers to a lot of the questions that you all answered there on that website. And you also have the ability to put in your zip code, and you'll be able to see what testing sites are available near where you are. So hopefully that'll be a helpful resource to everyone. Thank you again.
Hey, Sable K., thank you for being with us. That's real granular information there. All right, let's return now to Harrisonburg Mayor Deanna Reed. Final thoughts this evening, Mayor Reed.
Again, I want to Thank Dr. Underwood and the Health Equity Working Group for all you have done for Harrisonburg and the state of Virginia. Your mission to ensure that our most vulnerable communities in Virginia have access to supplies and training is simply saving lives. And so I challenge all the cities and counties to reach out to Dr. Underwood. She is very supportive of us, no matter how small our city is, how large our city is. She is there for us and to support us. And everybody stay safe, follow the recommendations of Governor Northam, and wear a mask when you go out in public. Thank you.
Thank you, Mayor. Look forward to visiting you in Harrisonburg soon. Dr. Hilton, final thoughts for us on this Thursday night.
Good. So what I know, I want everyone to know is that racial health disparities did not start with COVID-19, and it's not going to finish with COVID-19. With this pandemic ending, what I want us to do is actually concentrate on what are the factors that led to higher mortality rates for Black, Brown, for lower socioeconomic status citizens, and to fix those structures. And whether that's improving educational system, improving housing, improving transportation and access to healthcare, improving even how we zone things and where industries can plant their roots, and leading to higher respiratory infections, for instance, and chronic bronchitis and asthma for these children that have racial minority demographics. So I think that's what we need to concentrate on. And then in the interim, to get us through this, to make use of things like the CARES Act and the Pandemic Emergency Fund Acts, to allow people to be able to stay in their home, to really help the essential workers like the grocery store workers and those that are working in the retail industry, literally keeping our nation afloat, that we need to turn our vision towards them and say, how can we keep those heroes as safe as possible?
Dr. Hilton, thank you for your participation tonight. That's a great point. Countries in Asia have dealt with SARS and MERS before, and they figured out sort of a system that they kind of go through. This is our real first encounter with a pandemic of this sort in this century. Dr. Underwood, you brought us all together in a way here tonight. What are your final thoughts?
I'd just like to underscore what Dr. Hilton said, and the Health Equity Group is really doing that. We're simultaneously thinking about how do we respond to COVID-19 and how do we interrupt systems of inequity. And so with that, I would just say also wear a mask when you go out. I know we are socially distanced now on purpose, and we will resume wearing our mask as soon as the cameras go off. And thank you for having this team. We are excited to be with you, and we're hoping that the conversation continues. We're not done yet. We've done so much, but as my grandmother used to say, we're not where we used to be, right? But we're headed someplace, I think, together, and we're going to be stronger when we come out of this together. So I just thank God we're not where we used to be. I'd just also like to share with you the first time in Virginia history, all of Governor Northam's press conferences from Monday and going forward will be translated in Spanish. That is historic. And so we are doing so much to make sure the information of COVID-19 gets to all of the people that need to see it. So everything that we're doing is being translated into the top 5 languages spoken in Virginia and even more. So we're doing the work. We're rolling up our sleeves. And as the only operational equity task force in the nation, we are doing things like putting food boxes in the back of people's cars. We're collaborating with organizations and really reaching out in terms of community engagement, which is a pillar for our team. We are working with advocacy groups such as the Urban League and such as the United Way and even the Virginia Coalition of Immigrant Rights.
Wonderful. It's lovely to have you here, Dr. Janice Underwood. I want to remind folks at home of some of the information that we've given out here very quickly. If you need food and you speak Spanish, you can text comida or food to 877-877. 211 is a wonderful resource for information here in Virginia. If you have questions about your unemployment insurance, you can contact the Employment Commission and, of course, other state agencies as you need. So we want to thank you, Dr. Underwood, all of our panelists from the Virginia Health Equity Task Force for joining us for this discussion tonight. It's been very, very informative. If you're still looking for help We do have a list of resources online to make sure you get what you need. The things I mentioned before, links to the Department of Health, links to testing sites, to financial and nutritional support, help for healthcare, unemployment and small business resources, and much, much more. You'll find those in English and Spanish after our special on your local station's website and social media. So thanks once again for joining us for this town hall. COVID-19 and health equity in Virginia. You ask, we answer. I'm Juan Condi. Thanks for being with us. Have a good night.